Hello, I am Dr. Nagaraj Puttaswamy. I am a laparoscopic surgeon at Punya Hospitals, Bangalore. Any condition in the anal region is attributed as piles, at least in Indian scenario or South Indian scenario. But not all conditions are piles or hemorrhoids. There are different associated similar complaints or similar conditions which we come across. We find hemorrhoids or piles as one of the common things, fissure as one of the commonest thing, or a fistula. These all three are most of the times a very simple disorder which we come across. Very rarely we find perianal abscesses or ischiorectal abscess, or we find rectal or anal cancer. So all these are the common things which we come across in a person who comes with some pain in the anal region. Commonly, say pain related to hemorrhoids or piles. Usually we call that piles when a person comes with a painless bleeding. But a hemorrhoid can become painful if at all if one of the vein is thrombosed or infected. So during that condition, we can suggest for painkillers and local anesthetic agents, ointments, and maybe we can help the patient by giving him stool softening agents which will help him reduce the pain. But most of the times the patient lands up in a surgical procedure. A condition called fissure is there, which is otherwise very painful condition if it is an acute fissure. It is a small cut in the anal orifice. See, it is a cut usually either in the anterior or the posterior border, and it will induce severe pain during the process of defecation, that is at the time of passing stools. It may be associated with small streaks of blood on the stool which will be applied. This is easily managed most of the times medically, but if the anal orifice has been repeatedly traumatized by having hard stools or something like that, the patient may have to undergo a surgical procedure and correct his discomfort. A condition called fistula is there, which is otherwise a connection between the mucosal lining and the skin outside. Mucosal lining of the rectum or the anus to the skin of the surrounding area of the anus. The fistula presents as if it comes once in a week or 10 days. See, it will develop into a small pimple-like thing around the anal orifice, starts to developing into a bigger pimple and burst open and produces some amount of blood and pus-like material, gradually regresses. And again it recycles for another 8 to 10 days. So during this process, we try to tell the patient, I am fine in about 5-6 days, and again the pain starts after 5-6 days, it ruptures. So this is purely a surgical problem where we either use a set-on or we do a fistulotomy by a surgical procedure. Bare minimum medical management and antibiotic management will help the patient in reducing the pain for a short period of time, stopgap arrangement until he plans for a surgical procedure.